My name is Robert Handzo, and I'm going to be validating on setting up a sterile field and doing a wet to dry dressing. I've washed my hands, I've closed the curtain for privacy, and I've checked the doctor's orders. This patient is to receive a wet to dry dressing today and a dressing change. I'm going to check the patient's wristbands, make sure that they are who they are and are the patient. And I'm going to explain the procedure. Hi, my name is Robert. I'm going to be your nurse today. I'm going to be changing your dressing. How is your wound today? Are you in any pain? Okay, not in any pain. I'm going to raise the height of the bed just a little bit. And I'm going to set up my moisture bag. The bag is all set to break the dressing. And I'm just going to take a look at the current dressing. Notice any type of drainage, any odors coming from it, and I'm going to put on my clean gloves to remove the dressing. Noticing for any drainage, any color changes in the draining, any odors or smells coming off of it, and just take an overall look at the dress, or take an overall look at the wound, find out if it's clean. If there is any of the dressing left over in the wound, I would remove it, and I'm going to dispose of this in the moisture bag. I'm going to remove my clean gloves, wash my hands again, and now I'm going to set up my sterile field. Dispose of that. Now I'm going to be opening up my gauze. pad. I would ask somebody to retrieve an ABD pad for me if I didn't have it available. And I've also checked the expiration date on all of these things as well, and they have not expired. Now, I'm going to take my saline solution. If it was opened, I would lip it into the moisture bin with my hand covering the label. If it was unopened, I would pour it into the sterile basin, also making sure that it is not expired. Now I'm going to don my sterile gloves. Start with my dominant hand. Non-dominant hand. Dispose of this. Now I'm going to rearrange my sterile supplies. And now I'm going to begin to clean the patient's wound. Into the moisture. Bring it out. Clean from top to bottom in the middle of the wound. And dispose of it. And the outside of the wound from top to bottom. Clean the portion of the wound closest to me. Top to bottom. Dispose. Now I'm going to pack the wound. Bring it out. I would pack.
I introduce myself to the patient. I identify my patient. I explain the procedure. Provide privacy. So now I'm ready to
Continue to pack the wound. And now I'm going to take gauze and place it over the top of the wound.
I'm gonna assess the wound for and the cleanse, smelling, redness.
And now with my ABD pad, I'm going to place it over the top of the wound.
Exposed. Now I'm ready to set up.
The sterile. Now I'm going to tape the wound in a window pane fashion.
Check for expiration date. Number 7.
And the wound has been taped in a window pane fashion. I'm going to take a piece of tape and initial, date, and write the time of the dressing change, and place it on the ABD pad. I would dispose of all of my other sterile equipment. Remove my sterile gloves. I would wash my hands. I would document any findings and assess the patient again, find out if they're in any pain. If they're feeling okay, I would lower the height of the bed.
I'm ready to downstairs.
And that is how you set up a sterile field and do a wet to dry dressing.